If you have Social Security or Medicare, I think this video is of importance, or if you're trying to help your parents figure it out, I definitely think it is a must watch. This is Representative David Schweikert, and the video that's kind of gone viral in the last week or so, where he is basically saying, hey, it's not Social Security that's the issue, it's Medicare. Let's jump in. I'm gonna show a clip from the actual video, which I got from Forbes News. So credit goes to Forbes News for posting this. I am not the original creator of this video. However, I'm going to summarize the content so it's easier to understand and will condense your time frame on getting the gist of what the speaker was saying. So Mr. Schweikert expresses frustration with false information being spread by the press about Republicans wanting to cut Social Security. He states that in all his time, he has never met a single Republican that wanted to cut Social Security. That is just fake news that is being distributed. He expresses concern over the Congressional Budget Office's projection that Social Security will run out of money in 10 years and will result in a 23% cut in recipients' checks, which would double the amount of poverty amongst seniors. He presents a calendar to illustrate the scale of the deficit and showed that cutting the salaries of Congress and Senate would only eliminate a small portion of the deficit. The reason he did that is because lots of comments from the public said, hey, these guys are overpaid, they barely work, let's cut their salaries. And then he emphasizes the importance of addressing the structural deficit to prevent a debt crisis and threaten the public. So he goes on to say that Social Security has never been intended to be a sole source of income, although many people do use it as the sole source of income in retirement. And most experts, most financial guys are recommending you have multiple streams of income, and Social Security is just another arm in your entire income stream during retirement. Now, the Social Security system has been running a surplus, and the average couple that is retiring is going to receive about $700,000, those are inflation-adjusted dollars, in lifetime benefits after contributing $625,000 in the FICA taxes. So you're getting a little bit more than you actually contributed during your working years. The real problem, he says, with the U.S. sovereign debt is actually Medicare, where the average couple will receive about $522,000 after only contributing $161,000. So he is saying that, hey, Medicare is the big issue here, not Social Security on draining the debt. And he goes on to say that the solution is not to cut benefits for anyone receiving Social Security or Medicare, but to reduce the cost of delivering healthcare systems by using technology and other means. And then he says that Obamacare and Medicare for All only address financing issues, and they do not touch the actual problem of cost. The speaker goes on to address that the U.S. debt and the cost of healthcare, particularly in diabetes, and says by using technology, we could literally cure diabetes, and it would also reduce the financial strain on the system, therefore giving us more money and more money for everyone in the Medicare system. And he concludes with the importance of finding a solution and the need for bipartisanship to address the issue with emphasis. Now, I'll show a clip from what the speaker actually says, and I'm curious to hear your comments and thoughts on the subject matter at hand.
That's not what drives the debt. Our problem with Social Security is our number of workers. It's Medicare. And this is hard to talk about, but math is math. And I know many people will come up to me and say, you can't talk about that, you're going to get unelected. I'm in one of the most competitive districts in America. But at least I'm in one of the best educated, smartest districts in America and understand whether you like me or not, I'm telling you the truth on the math. Here is the substantial portion that drives about 3/4 of all U.S. sovereign debt. The average couple in their lifetime of working will put in $161,000 into Medicare. Remember, the Medicare tax you pay as part of your FICA, your payroll tax, is just for the Part A, the hospital portion. The rest of the healthcare spending you get when you become 65 and are on Medicare comes out of the general fund. The average tax-paying couple put in that $161,000, and they're going to get back $522,000. And this number is based on sort of before the inflation cycle. We're working on some math, but I wasn't able to vet it, that the amount of money we expect in medical costs for our brothers and sisters on Medicare actually has gone up rather substantially, which that means when you say 161, 500 plus, that gap, now multiply that towards how many? 70 million Americans, 65 up, and the number grows with baby boomers? Because what, just the baby boom population is what, 76 million? You see the driver of U.S. sovereign debt. The solution is not cutting. The solution is having a revolution of the cost. Obamacare was a financing bill. It's who had to pay and who got subsidized. Actually, it was mostly about subsidizing. The Republican alternative actually spread out the actual numbers so you got some efficiencies, but it was still about who had to pay and who got subsidized. Medicare for All is all about subsidy, but those are financing bills. They don't touch the problem. The real problem is the cost of delivering healthcare services. And for people who might say, well, he's not giving us a solution, go look at the probably 70 hours I have over the last few years on the floor here. Half those were bringing solutions. Most of my solutions are uncomfortable because they require disruptions. It's technology. It's a thing you can blow into that knows you have the flu and allowing it to prescribe. Taking on the big things, curing diseases. Turns out cures are remarkable at crashing the price of healthcare and just the basic morality of it. If diabetes is 33% of all healthcare spending, and there's chance out there that there's been some success in curing type 1 with a CRISPR-altered stem cell treatment, maybe it works, maybe it doesn't, but the literature right now says there's about 6 people who've been cured of type 1. We need to know this. We need to find out over the next decade, could it be for type 2? What do we do on the farm bill, on nutrition support and everything else? Is that the possibility? Because if you could disrupt that cost, you realize if you could disrupt just half of the diabetics cost in this country, you'd actually wipe out the substantial portion of the next 30 years debt. These are moral, but they're also financial ideas. And we run away from them. It's almost easier for members of Congress to talk about cuts than it is to competition to disrupt business models. So understand the next time you have someone saying, well, if I could just get all my money I paid back in FICA taxes, we'll make that deal because you're getting that couple is getting hundreds and hundreds and hundreds of thousands of dollars more than they put in. It's the math. Whether you feel that way or not, it's the math. And that's the primary driver of U.S. sovereign debt.